India has crossed the 5 lakh mark as it reports the highest single-day spike of 18,552 new cases, 384 deaths in the last 24 hours. Now, Maharashtra, Delhi, Tamil Nadu and Uttar Pradesh recorded the highest daily jump for the 8th day in a row. The silver lining is that the recovery rate has been steadily improving to touch 58%. Over 2.9 lakh patients have recovered as opposed to the 1.9 lakh active cases. The fatality rate has also gone down to 3.1%. Over 79 lakh 96,707 samples have been tested until now. Union Health Minister Dr. Harshvardhan will be chairing a meeting with the group of ministers to discuss the situation ahead. Let's now take you through the details of how many days it took for India to cross each lakh of COVID-19 cases. Let's put those numbers out on your screens. Remember, we've taken 149 days to reach the 5 lakh mark. From 0 to 1 lakhs, it took us 110 days. Important to note that from 100 to 1 lakh cases, we took 64 days. So we took most of those days, in fact, about almost 50 days, just to reach from 0 to 100 cases. In fact, switching focus to the next lakh, which is of course 1 to 2 lakhs, we took 15 days. You can see the number of days has drastically reduced. From 2 to 3 lakhs, we again took 10 days. Once again, a drastic reduction from 15 days. From 3 to 4 lakhs, 8 days. And remember, in less than a week, we have now touched the 5 lakh mark. So the surge in cases, of course, has been worrying, but remember, the government is constantly saying that our recovery rate is high as well, and one shouldn't only focus on the cases as such. Going across to Sneha Murdani, who joins us for more details. Sneha, we just put those figures out on our screens as to that shows that it took so long, so many days to reach the 1 lakh mark, the 2 lakh mark, but there's been a sudden surge and the numbers have climbed up for us to reach 5 lakhs in less than 6 days.
That's how the virus, yes, and that's how the virus essentially, Vandana, is behaving, not just in India but globally. And also what we see is that as you open up, obviously Karnataka is case in point. Bengaluru, for example, was reporting less number of cases, and after opening up there was a surge. And how we've seen the spike in the city of Bengaluru as well, initially touted as an ideal model, as an ideal city which has managed to contain the infection. Now we're talking about possibly some sort of a lockdown in the state of Karnataka. You know, I just want to tell you that in the last 5 months, from the first case reported on the 30th of January until today, it's been 5 months and less than 5 months, in fact, and we've touched 5 lakh cases, more than 5 lakh cases in the country. The government has always said that the lockdown period essentially was to prepare the healthcare system. A lot of progress has been made in that direction, but it does appear that there still is a lot of burden on the healthcare system. Let me just walk you through the details of what has happened vis-a-vis testing in the last 5 months. You did mention that we have close to 80 lakh samples, RT-PCR samples that have been tested in the country. That's one form of testing. Antigen testing for diagnostics has begun and is picking up in the country. We have a South Korean firm which is in fact which is the technology behind antigen testing in the country. We have antibody testing. The technology was transferred by the NIV Pune to Zydus Catalan in the country, and that's how these ELISA test kits now are being used for infection antibody testing, for gauging the spread of infection in the community. That has been started essentially, and the private labs accredited by the NABL are being allowed to do these tests as well. Having said that, the number of RT-PCR testing has gone up in the country. More than 220,000 samples have been tested in the last 24 hours. We're pretty much utilizing a capacity of more than 1,000 labs from the time we had one single lab in the country. So that's the kind of progress that has been made in the last 5 months. But looking at the numbers, Maharashtra reporting more than 5,000 cases. We have Delhi, we have Tamil Nadu reporting close to 4,000 cases. And this is going to, worsen, if I can use that word, even further in days to come. For the last 1 week, we've consistently reported more than 14,000 cases in a single day. Today, we've reported more than 18,000 cases in a single day. This is as per expectation, is what we've been given to understand. The government sources indicate that a peak is unavoidable. What we've done during the lockdown is avoid the peak at reaching at an earlier stage, so that our preparedness is such that when we are at a peak, we are not overwhelmed in the system. But we've already seen indications of being overwhelmed in the system, at least in cities like Mumbai and Delhi, and also a couple of handful other metropolitan cities where the number of cases are increasing. But there are going to be area-specific containment strategies, is something that is very clear. The mandate has been given to the states to decide how they want to take forward. The broad framework is given by the Indian Council of Medical Research and the central government on what needs to be done, but then can tweak the rules accordingly to suit requirements at that point in time. So this is an ongoing process, and yes, it's going to be take a while before things get back to normal.
All right, Sneha, thank you for helping us understand the overall perspective. Now, focusing on Delhi, with over 3,460 new cases, Delhi has breached the 77,000 mark. The national capital will begin its ambitious serological survey today with a comprehensive sample size of 20,000 that will include minorities, those outside containment zones, and cover each of the 11 districts. The result is expected to come on the 10th of July. The Delhi government has also ramped up testing and tracing aggressively in the city. Over 21,000 samples were tested yesterday, 4 times higher than any other state in the country. Now, starting today, field teams are fanning out across all 11 districts of Delhi for a serological survey. This survey will give authorities an accurate picture of what proportion of the population has been exposed to the virus. Rupeshri Nanda with the details.
Delhi is in the next phase of its battle against the coronavirus. A serological survey on 20,000 people across 11 districts of Delhi, both inside and outside containment zones. This test checks if antibodies are in the blood and, by extension, whether that person has been exposed to the SARS-CoV-2 virus.
Antibody survey in the population of Delhi will give us a periodic prevalence estimate of the number of people exposed, as well as some idea of what are the levels of immunity that the Delhi population have developed and what proportion are still vulnerable and susceptible and need energetic protection.
Field teams consisting of a doctor, a technician and a local level health worker are carrying out the survey. The surveillance is done by random sampling across all age groups, including minors, and will be done on both those with symptoms and those without. A sero-survey already carried out by the ICMR showed less than 1% of the population in 83 districts were infected. But it also indicated that urban areas were more at risk.
Previously, the study was limited to the containment zones of Delhi, whereas this one is going to be a random sample of all of Delhi. Generally, 20,000 is a reasonably good sample size for the city of Delhi. But it ultimately depends upon what the actual prevalence estimate is.
The results of the serological survey will be available on July 10th, and it will help authorities determine the proportion of population exposed to the infection. The findings are also critical in gauging whether Delhi has entered stage 3, the stage of community transmission. Post-Delhi, a serological survey is also planned for the high caseload cities of Mumbai and Ahmedabad.
It is very much plausible that the serological survey here in Delhi will be completed on schedule. And with a robust sample of 20,000, it is also very likely that the survey will include people who live in the back of the beyond in Delhi, in gullies like the one that I'm standing in. However, the question remains, when will the result of that survey be made public? Because remember, a similar survey had been done for cities and we still do not know what the outcome of that survey was. This is important because it will have implications on the capital's COVID-19 battle. With camera person Raju Khetri, in Delhi, Rupeshri Nanda.
Well, bringing in Rupeshri, who filed that report for us. Rupeshri, help us understand the implications of the survey and why the results are so critical for the Delhi government.
Vandana, in fact, this survey is part of the revised COVID action plan for Delhi. It was specifically recommended by the Paul committee, which was instituted by Home Minister Amit Shah. But even before that, the Delhi government and the Union Health Ministry had been considering a sero survey, especially because such a survey has not been done anywhere in the world, anywhere in the country as of now. And because of its comprehensive nature, that it is going to include people not just in containment zones or high-risk areas and not just who are showing symptoms. So for the first time, it is going to include those who have been left out of the surveillance of the testing that has been done in Delhi so far. It is also going to include people who are below the age of 18 years, that is minors, and will be spread across the 11 districts, and it will be a robust sample, robust sample size and robust statistical model, which is why the results are keenly awaited, because it will give us, once if the results are out, it will give us a sort of a academic confirmation also about the spread of the disease here in the capital, and which are the sections of the population which are most affected. Now, Vandana, I am standing here in Sadar Bazaar, actually in front of the DGHS office. If my camera person Raju Khetri can just show you this particular location. Now, this is where the office is located, and this is where the training for the people who are going to collect the samples is still on. Now, we are getting to hear that there will be teams of 3 to 4 people, and at 11 a.m. they will be leaving this particular building and be fanning out into different areas of Delhi. Now, if in this particular location also, if my camera person Raju Khetri can show you, look at the congested nature of this particular gully over here. Now, remember, this is in Sadar Bazaar, one of the areas in Delhi which has been contained so far, and also where the prevalence of the disease is high. So this is these are the kind of places where the samples are going to be collected from. There is also concern that the privacy of those people whose samples are going to be collected should be maintained. Apart from that, it is going to kick-start today, but it is going to be more robust in the following days, that is tomorrow and day after. So results of that survey will be keenly awaited. We have been told that results will be out on 10th of next month, but we really have to wait and watch for that.
All right, so preparations underway for that critical survey. Thank you, Rupeshri, for getting us that ground report. Let's now move over to the state of Maharashtra, with over 5,000 cases taking the state's total tally to 1.5 lakhs. Former Chief Minister Devendra Fadnavis wrote to Chief Minister Uddhav Thackeray yesterday, expressing concern over the rise in cases. In his letter, the BJP leader claimed that there were huge anomalies in Maharashtra's battle against COVID, from capping the number of tests to discrepancies in the number of deaths being reported in Mumbai. Fadnavis urged the Chief Minister to order a probe into the matter. He further asked Uddhav to not create confusion in the middle of people by frequently changing the state guidelines on the fight against coronavirus. Well, going to Mihir Trivedi, who joins us live from Mumbai for more details. Mihir, questions raised by the BJP over the data being presented by the BMC. But at the same time, remember, the BMC has given a fresh deadline to hospitals in order to complete this reconciliation exercise as soon as possible.
Absolutely, there are certain allegations that are being made by the former CM Devendra Fadnavis, saying that the reports and the numbers as far as the deaths are concerned in Mumbai are not properly reported. Some of the out of the hospital deaths have not been included in COVID numbers, and that is the problem here. Of course, also there is questions being raised as far as the capping of tests is concerned, but the health minister has come out and refuted all these claims and said that the reason there is a rise or spike in the number of cases in one day, that 5,000 number, is because tests have been ramped up, and of course they are reporting everything with absolute honesty and clarity without hiding any figures. Mumbai is one of the integral parts of the state of Maharashtra and a big contributor as far as the COVID numbers is concerned. But Mumbai is seeing positive signs as far as the city is concerned. On an average, the doubling rate has really gone up. It is above 40, and which is a good sign. And the growth rate has reduced. It's under 2%. However, there are some trouble spots. The north region, especially, where there are certain wards where the doubling rate is just 20 days, and that is worrisome. And of course, the growth rate has increased significantly to 3% and more. So these are the spots where the BMC is really focusing aggressively. There is door-to-door screening, testing, tracing and treatment is being done here to ensure that the virus is contained and doesn't spread further. Also, we know that Thane is another spot which is seeing a rise in numbers. As far as the COVID numbers is concerned, there is a significant rise on a daily basis, and from what we know that in one day there has been a spike of over 200 cases, which is worrisome. And now the authorities there will have to really significantly work towards containing this virus and aggressively make sure that this region is protected by testing, tracing and treating the patients and ensuring that proper screening in areas which are vulnerable is done so that the virus is contained.
All right, Mihir. Thank you for getting us all those details. Now we have some breaking news coming in. This is a